Moments That Matter is brought to you by Binkley Ross Family of Funeral Homes and by Melise's.
Hi, everyone, and welcome back to Moments That Matter from the Voyage Senior Living. I'm your host, Melise Oakley. May is Stroke Awareness Month, and we're talking about something that can affect so many families, yet often catch people off guard. A stroke can happen suddenly. Knowing what to do, what to look for, and what you can do to make all the difference. I want to welcome back our guests from Deaconess, Courtney and Jessie. So I'm just going to start really simple. What is a stroke?
So first of all, there can be two different types of what most people refer to as strokes. So an ischemic stroke is when you have an interruption of blood flow to a certain area of the brain. And then you can also have a brain bleed or a hemorrhagic stroke.
Okay.
Which is when a blood vessel in your brain usually bursts and causes bleeding in the brain tissue.
Either way, it's very serious.
Yes.
What is the key for treatment for this, especially when, like, if you catch it early or things like that? So tell me what the key is.
Yep. So the big key for any kind of stroke is time. There are treatments available. They are very time dependent. So every minute that you go without blood flow to the brain, your brain cells are actively dying and you're losing that tissue. Brain cells don't regenerate, so you're not going to, recover that portion of your brain. So the quicker you get to the hospital, the quicker we can evaluate you for treatment options and hopefully restore blood flow to the brain.
I can't even remember the last time I heard this, but FAST. But now there's something new?
Yes.
Okay.
Yes.
And what is that?
So we have added 2 letters to the acronym. So
Okay.
it's no longer just FAST, it's BFAST. So still very, memorable with
Yes.
the word. So it's not only about, facial weakness, arm weakness, leg weakness, slurred speech. We're also looking at different stroke symptoms. So B is for balance. So any issues with balance, falling to one side, or kind of just being wobbly in general, as well as headaches. We kind of throw headaches in with the B as well. And then E is for eyes. So any vision changes, loss of vision in one eye or loss of vision in a field of your vision. Those are stroke symptoms that just happen in a different part of the brain, maybe not as common or as, known to people that you would see. But they are just as serious, and losing your vision and not being able to walk appropriately is very disabling. So we want to catch those as well.
Educate us about the FAST.
Yes. So with the rest of the acronym, F is for face. So it's for facial weakness. Patients notice this in themselves sometimes looking in the mirror, but a lot of family members catch this because they're like, you look a little different today. Or, when you're trying to take a drink, it's like falling out of the side of your mouth, almost like you just had, a dental procedure and had your face numbed, like that kind of a feeling.
Like a Bell's palsy.
Yes.
Okay.
Yep. Just like that. Yep. And then the A is for arm or leg. So it's weakness or numbness.
Okay.
So, that's a little bit tricky because we add the leg in there as well. But generally in stroke, it's going to be unilateral. So one side of your body is affected, and it could be your arm and your leg or just one. And it could be weakness or numbness.
Okay.
And then S is for, is for speech. So it can just be a change in your speech, like you're slurring your words a little more than you normally would. Or it could be that you're speaking, but it's not appropriate to the situation. So words are coming out, but it doesn't make any sense into the context with what conversation that we're having.
Or it could be like a word salad.
Exactly. Yep. Exactly.
Just all over the place.
Right.
Yep. Okay.
And then T, our biggest one, time. So the second that anyone notices a stroke symptom, the biggest thing is not to wait. Don't take a nap thinking things are going to get better, thinking I'll call my doctor tomorrow. Calling 911 as quickly as you can and activating the emergency medical response is the best thing to do to get you to the hospital the quickest. If it's not a stroke, that's great. We're happy. We can help fix whatever it is that's causing your symptoms, but we just don't want to miss a stroke because missing a stroke can be very disabling for patients.
Especially with women, that seems like sometimes they will wait because, I'll just sleep it off. So you said make sure that
Yep. Or they're caretakers for someone and they can't, they're very heavily relied on. So we can't, be missing from that. And, not taking care of yourself is a huge reason for missing, your time window for stroke treatment.
So trust your gut and act fast.
Yes.
That's what we need to do.
Yep.
Okay.
Exactly.
Let me ask, who is at risk for a stroke?
Right. Really, anyone is at risk, but some patients carry a higher risk. So people who have high blood pressure, people who have diabetes, are, very obese, have great risk because their blood vessels are a little bit damaged. So it can cause an increased likeliness of, blood clots or little plaques getting stuck in the brain, leading to decreased blood flow. Same as you would think of as a heart attack. So same kind of concept, just in the brain. Patients who smoke are at very high risk. And then patients who have high cholesterol are at risk.
Okay. So those are kind of like the check off box. But anyone.
Yes, but anyone.
At any age.
And we are seeing a greater population of younger folks that are having strokes. Of course, some of that is substance abuse related. But I think, there's more research being done as to why our younger population is having strokes too. So
it's kind of scary, but nice to know, because knowledge is power. So if someone does have a stroke, what does it look like for recovery and also hope? Because you immediately when you said it, I'm just like, oh, like you think the worst.
Right.
So what does that look like?
Starting just with treatment in general, if you get to the hospital quickly enough and you meet criteria, we could give you a really strong clot busting medication.
Okay.
So the point of it is to dissolve the blood clot that's causing your interruption of blood flow. And then we hope to see, restoration of some of your function. So, sometimes it helps beautifully, sometimes not, but we want to give the patient every chance to recover well. After that, you're going to be in the hospital for a little while, just checking out any possible reason why you could have had a stroke. And can we help, fix that reason so that you don't have another stroke? Do you have an abnormal heart rhythm? Do you have, any underlying condition? Even sometimes underlying cancers that patients aren't aware about can cause your blood to be thicker and can cause you to have a stroke. So we rule all of those things out just to help prevent another stroke, because that's our biggest thing, preventing another stroke and then rehab. So we have, lots of rehabs around here for our patients to go to, depending on what level that you need. It could be a swing bed, it could be skilled care facilities or an inpatient rehab. But we try to give every patient the individualized care that they need based on what kind of deficits they have after their stroke. Whether it's speech, we'll be very intensive with speech therapy to give them every chance to start speaking back to their normal as possible. Same with arm or leg weakness, working really hard with physical and occupational therapies to get the patient to be as independent as they were before the stroke occurred.
And all those things will help for recovery.
Yes, yes.
And the brain is very cool because while you can't produce new brain cells and the cells affected by your stroke and that tissue is essentially gone, the area around your stroke compensates. So like as you're doing the therapy, you're developing new pathways to get those skills and that function back. So that's why therapy intervention early is very important. So you can really start working those areas of your brain and making those new connections and getting some of that function back.
That's nice because there's hope,
Yes, yeah.
Because it is a very scary word.
Yep.
Yes.
And I'm very fortunate. I've not had to really deal with that in my family history, but to know that there is hope, that's amazing. And the technology that they have and getting to it. What do you think is the biggest difference in now with strokes on the aspect of treatment? What would you say about that?
Advancements in stroke treatment have taken leaps and bounds, especially between even just last year and this year.
Oh, okay.
So,
and how is that?
So several years ago, like our time frame for thrombolytics was like 3 hours. If you were normal at 9 a.m. and you came in at 10 a.m., we could maybe give you treatment. But now it's, 3 to 4.5 hours.
Oh.
Advancing even further to evidence from this year, it's much, much longer. So up to 24 hours, we can do specialized imaging that can tell us if there's tissue in your brain that can be saved. We're going to do everything we can to save it. So our population of patients that we have the potential to treat and help has gotten much, much bigger.
So what do you think the biggest obstacle is for people that don't come in?
Yep. So I think the biggest obstacle, especially where we're at, is just being rural. And patients don't, they don't come to the doctor as much. So they may be a little bit sicker, have a lot more chronic illnesses in rural areas. They're not close to the hospital, so they don't maybe have a family member to take them. They don't want to call 911 because they don't want an ambulance bill because their insurance isn't as well. So there's a lot of factors about getting patients here. But another, we really like patients to take EMS to the hospital because it kind of sets our team in motion before the patient even gets here.
And it's safe. Too,
yes.
right? Like
safe.
if you're having some of these symptoms,
Yeah.
it may not be the best idea to get in your car and drive yourself somewhere.
Right. But a lot of our patients say, I can get there faster driving than I can waiting on the ambulance to get here. So it's just helping them see it from a different perspective because we definitely understand that too. We just, like Courtney said, want the patients to be safe. And then activating EMS activates our stroke team and everyone starts in motion before the patient even gets to the hospital.
That's interesting because I never thought of it that way. But that is a beautiful thing because it's just like call ahead seating.
Right. Yes. It exactly. Yes.
It gives everyone in the hospital a heads up. The ER team gets a heads up. Our stroke team gets a heads up. The imaging team gets a heads up. So essentially when the EMS crew brings them in, we're all there waiting for them. Yep. So ready to go.
Yes.
That's great. Yeah. I never even thought about that. So that's something that even though you're not there, they're setting everything up. They're getting everything in place so they can do the best they can.
Yep.
And I love the 24 hours. Like I didn't even know that. That's amazing. And it just keeps on, cutting edge and so forth.
Yep.
Would you say to like caregivers and families when it comes to stroke, what would you say to them on helping them get back for treatment and so forth?
It can be especially hard for family members depending on what the patient's, stroke deficits are because they aren't necessarily the same person anymore because it can affect their personality and things too. So it can be really, really rough for family members, especially if they're going to be their primary caregiver when they go home. Just knowing that there's, it's a long process. It's not, in 2 weeks, I'm going to have all of my, regain all of my function. It's, a 3 month to 6 month, even up to a year process to really retrain your brain, depending on how big your stroke is, to get some of your function back. So just being realistic so that the family members don't think, okay, in a couple of weeks, they're going to come home from rehab and they're going to be themselves. That really may not be realistic for the patient. So not sugarcoating something to give false hope. We want you to always have the hope, just knowing what the journey is going to look like. And then how best they can help modify the situation for the patient, whether it's a different kind of diet, removing obstacles within their home that's going to make it harder for the patient once they get home. They may need to have a wheelchair ramp installed, different ideas of what that's going to look like down the road, but also that they're not alone. And our area, which we're trying to work on getting a little more support in the area, but there are support groups in the area for the patients, for their family members that can come learn more about how to prevent another stroke, why you had a stroke, things to do at home to help. And so it involves the family, not just the patient. So it's, it's a family effort and not just I'm alone helping my family member, I'm alone being the stroke patient. It really gets everyone integrated.
Because if you feel like you're part of a team and I was also going to say like people's positive thoughts, it does do so much. Yeah. Yes. And so then if you also have a community that supports you, that's even more. Yeah. So getting the support, I love that too. Yeah. Wow, this is a lot because I mean, you think about it, like we could be out in community and you see somebody and so that's encouraging to know that there's stuff that can be done because it is a scary process.
Yep, definitely. Yep.
I appreciate the fact that you guys came in today and talked about this because you don't know what you don't know. Right?
Yeah.
Yeah, exactly.
And we need to be a community that's educated. And we even talked about maybe going into different communities and we have some things. So I really appreciate that you guys are collaborating with us because education is power. And it's the moments that matter. And this is the moments that matter.
Right.
These are the times that we need to get educated about our loved ones and to know that there is hope, there is support, and there's the right places to get that kind of help. So thank you so much.
Yes,
Appreciate
thank you for
it.
having us.
As we close today's episode, I want to leave you with this. Stroke awareness isn't just information, it's empowerment. It's knowing what to do in a moment that matters. It's protecting the people you love. Take a moment today, share what you've learned, talk with your family, and save those Be Fast signs in your phone, because you never know when you need them. Thank you for joining me on the Moments That Matter from the Voyage Senior Living.
Moments That Matter is brought to you by Binkley Ross Family of Funeral Homes. Locally owned and operated. Binkley Ross Funeral Home, Blue Funeral Home, Mitchell Hughes Funeral Home. Call 618-997-7771 or go to binkleyross.com. And by Melise's, tuxedos, menswear, custom embroidery, and apparel. Melise's, the best little suit shop in town. Call 618-993-1800 or go to melises.com.